Welcome everybody to today's Blueberry Pediatric Podcast. Today we are going to talk about mental health in pediatrics because it's Mental Health Awareness Month, if you didn't know. And why is this so important to us as pediatricians and to the general population? Well, recent data reveals that approximately 46% of American adolescents aged 13 to 18 will experience some form of mental disorder, with about 21% facing severe impairments in daily functioning. Alarmingly, suicide has become the second leading cause of death among individuals aged 10 to 29 in the US, surpassing fatalities from cancer, heart disease, and other major illnesses. The COVID-19 pandemic has exacerbated these challenges, leading to a significant increase in mental health issues among children and adolescents. For instance, the National Health Service referrals for children's anxiety in England have more than doubled since the pandemic, with over 500 children being referred daily. Social media usage has been strongly linked to increased levels of anxiety and depression among teenagers, particularly among girls. These statistics highlight the critical need for early intervention and comprehensive mental health support for our youth. So let's delve deeper into this topic with our panel of pediatricians from Blueberry. I would love if you both introduce yourself. Let's start with Kristen.
Hi, everybody. I'm Kristen. I'm a general pediatrician in Florida.
And I'm Tiffanie. I'm also a general pediatrician. I am in Charleston, South Carolina.
Great. Thanks for joining. All right, let's start with why we think that there's such a steep rise in pediatric mental health diagnoses.
I would love to address this topic. I think part of it is the world that we're living in, right? If we actually look at the world with the increase in social media usage, screen time, less outside time, that's a huge one. I also think that awareness has grown and increased in what actually affects our health and our well-being. So it's not only that we're living in a different world that's increased it, but actually we are looking for it more often. We're paying more attention, and we realized that mental health affects physical health and is as important, if not even more important, if you think about it, is the scope that we go through. So I think it's rising from both awareness and environment.
I completely agree. Kristen, anything to add there?
No, I mean, I just also think that our kids maybe are a lot less sheltered, than they were. They're more aware of, everything going on in the world. When we were kids, we had no access to that kind of stuff. There was no social media, anything like that. And so, I think not having the emotional maturity to be able to deal with hard topics yet, but still being exposed to them and seeing them every day, I feel like that contributes as well.
Absolutely. So as pediatricians, we are responsible for the physical health of children, but also their mental health. And so there are initiatives to screen for kids when they are in office, hopefully out of office too, which is what we're trying to do also. And some of these screeners are usually given during well child visits. So if you're not speaking about this stuff regularly with your pediatrician, you should be. And if you have any concerns, they're a great first stop for bringing up these issues and getting help and referrals out and understanding what's available in the community. So let's talk about these well child visits and how they can help or why they're kind of like the baseline backstop and safeguard for kids' mental health too, along with physical.
Yeah, I'm happy to tackle this one. So before Blueberry, I did, general primary care pediatrics for years. And we did these screeners at every well child checkup and more often as needed. And, I think it's really important to think about how many kids we picked up who were suffering from sometimes really severe depression or anxiety that nobody had any idea. Their parents had no concerns. They said nothing. They acted fine, for the most part. And, we're seeing them sometimes only once a year. It's hard to really tell when there's a change in their, demeanor or anything like that. And I was shocked at how often, until you really look at these scores and then get the kids alone and talk to them, you would really have no idea. And they're suffering in silence. So I think screening has really enhanced the ability to pick up kids who maybe aren't comfortable talking to their parents, or they're just not at that point yet where they're ready to address it, but really need it.
Yeah, or maybe they don't notice themselves. They don't know the difference, and that's how they function.
That's how their brains work, you know?
Yeah, that's how they're wired. Yep.
Yeah. And
sorry, go ahead.
I was going to say, I also think the screeners are a great tool because it starts bringing the topic in. It's bringing it to a level and an awareness where before maybe they weren't even thinking about the topic. So by bringing it something that becomes a normal part of assessing wellness, it also makes it more comfortable for people. It helps take away some of the stigma because we are talking about it without applying stigma.
Yes, absolutely. I think we should dive into that more, which we can later, but the stigma around it, I think, is a huge barrier to getting care. Mm. Yeah. So these screeners, they're not complicated. If you're not familiar, they're very few questions. They're very simple. This is not me quoting one, but it's really like, are you sad often? Like, they're very simple, but what they bring out is just so important. And these also are important for moms to take. So if you're a mom and you have maybe just given birth and you're going in for your child's well visit, which means a weight check feeding, poops, pees, all those fun things, physical exams for babies, we check regularly for mental health issues for the mom, because postpartum we know is a tumultuous, crazy time. So we also do screeners in office, and Blueberry's also going to be doing them for moms to make sure we're checking in with them as well.
That's huge because we all know that having a baby is exhausting, right? And being able to recognize what is outside of the realm of normal, and that you could use some additional support for yourself, because learning how to take care of yourself is super important when you're taking care of other people.
Absolutely. And maternal health, and if there's depression involved, it impacts a child's development and emotional regulation. Kristen, I think this was something you wanted to bring up.
Yeah, some studies are now showing that children who experience early trauma or who have parents that are depressed or struggling have a higher risk for having mood disorders, anxiety, PTSD, things like depression, substance abuse later in life. So, I think as moms, it's really easy to say, I'm going to come last. I'm going to take care of you first. But, if you really want to put your kid first, that also involves taking care of yourself. It's really important.
Absolutely. And I speak to moms about this regularly, about their mental health, but also their medication. It's so important that there's always risk benefit when pregnant with a baby or breastfeeding, but mom's mental health needs to be probably first. You can't be a mom, you can't be present. None of it matters. None of it matters if you can't actually function and be there in the way that a mom needs to show up. It's required of them because it's a baby and they're helpless. So I agree with that as well. All right. So let's talk about that stigma we had talked about before, and why people might feel that there's a stigma around mental health and what it's a barrier to.
I feel it's getting better, but there was a time when accepting emotions and feelings and admitting that you just weren't happy all the time was something that was frowned upon. And emotional intelligence was not a topic of conversation when I was a child. So it's something that's become newer, and learning that actually all feelings and emotions are normal and human, and learning how to deal with them is a sort of newer in the past 10, 15 years topic of conversation. So when you're being raised by people that haven't learned to address their own feelings and emotions, it makes it hard to know how to recognize that it is okay to say, this is feeling hard, I could use some help. So I think part of the stigma is just the change in people not having addressed it when they were younger and knowing that it was okay. Mm-hmm. I'm glad to say that I do think that is changing with different things, but it is conversations like this bringing it out into the open that helps make it easier. Acknowledging, talking about social media, acknowledging that like life isn't perfect all the time and you're not looking at everyone's highlight reels as a basis of comparison is just as hard for adults as it is for children.
Yeah.
Yeah,
absolutely.
And seeking help, even if you knew that your emotional health was maybe not where it should be, when we were kids or for our parents, if you needed help, it was like there was something wrong with you. And I think especially older generations, it's really hard to get that out of your brain and realize that it's okay, like it's okay if you need someone to help teach you how coping skills or how to deal with things. So,
yeah. Do you have any advice on how to broach this as a parent with your, let's say, 14-year-old girl that doesn't want to open up, or just kind of check-ins? This is tough, I find.
I mean, in my household, as I was saying, besides being a pediatrician, I am the mom of a almost 15-year-old and a 16-year-old boy.
Perfect. Perfect for you.
We have been talking about feelings and emotions and mental health and checking in and saying that we're always here for you if you need to come if a conversation's hard. And it is a legitimately daily topic of conversation. What went well today? What felt hard today? How are you doing? So again, and I also think it's important as the parent to be willing to express your own feelings and emotions. Acknowledge when something feels hard to you. Acknowledge when you're having a hard time. Take responsibility so that they're seeing that as a model as well, that it's not something that they have to pretend and that they're not responsible for your feelings. You get to acknowledge, bringing up the topic, or if you're noticing a change, being able to say, I noticed that I'm feeling a little scared about that you might be going through something. How would you like to address this? And then listening to your child, really helping them feel seen without pushing the conversation in a way that they may not be comfortable with. So being able to take a read on it and say, would you like to have a conversation with this? Sometimes talking when you're in the car where it's not direct eye contact would be helpful, or write a letter. But, just continually, I think, checking in and saying, I got you. How are you doing? Just need you to know I'm here for you.
Yeah. And starting it early. Like, I feel like if we normalize this from the get-go, if my 3-year-old is used to us talking about anything, talking about the day, that is so important to bleed into life. And I love that car thing, like the check-in on the way home or over dinner, like, hey, what happened today? Like, tell me something good. And also like not shutting down feelings, I think is one of the hardest things, because we have a tendency to be, don't cry. There's nothing to cry about. That's something you hear everybody say. And like, I know for me, I had to like really mentally try to rephrase that in my head. Like, okay, it's okay to cry. Then let's talk about what's going on that's making you feel this way. But, it's just, I think like even those tiny little things make such a difference. And the stigma's hard. I mean, it's hard to change the way you think about things.
Well, starting young, I think, to your point, really does alleviate that stigma as they grow, because it just becomes a normal part of their everyday because they talk about it. So hopefully it's not there for them as much. My kids my oldest is 9, and we've been doing for all of them, even my 3-year-old chimes in, we do peek and pit for the day, or there's like a rose, a thorn, a something.
I don't know.
Do you know that one? Oh, I forget what it is. Seed. I don't know. But we do peek and pit. So just like a very basic way for them to understand there's a highlight and a low light in the day. And maybe that low light, and we should celebrate the highlights. The low lights might bring out something that is upsetting them and is just easy for them to talk about, because we're always talking about these things around the table. In terms of resources available, I think this is also a limitation to kids getting the care that they need. There's just only so many mental health providers and only so many like insurance payers that will pay for these things. Do you find that that's been a barrier? Do you think that is, or maybe parents don't even know where to start there?
I think that's a huge barrier, actually, because it's seeking care. It can be expensive if it's not necessarily covered. So finding someone that's covered, I think it's getting better with the use of telemedicine and the ability to speak to people that you don't actually have to get to the office necessarily. But I have found that it has been a barrier living in different, I lived in a rural community for a while and there were no resources there. going back 14 years, people weren't using telemedicine, and not every family could travel to Savannah and, go 90 miles once or twice a week. It is, I think there are more resources becoming available for parents that are willing to educate themselves, podcasts, reaching out, resources that we can provide in that way. But hey, love to have more mental health professionals in the world.
Absolutely.
Yeah, I think also in the field of psychiatry and psychology, there's been a big push to not deal with insurance because they want to focus on the patients, which has its benefits. But I think that in the end, patients who can't afford to pay out of pocket, when there's only a small group of people that actually take insurance, the wait lists end up being so long. So even, being in the suburb of a major city, I had patients waiting 7-8 months to get in to see a therapist, which, is tough when they're in a crisis right now,
Yeah, there's a big push from even the federal level to get more peds mental health availability out there, and telehealth has made big strides in that sense. I think the first thing a family can do is always check with their insurance carrier and see what resources are available to them through that. Hopefully they are now partnering with some telehealth vendors where there is availability. There are several out there. Even we've partnered with some as referrals because we want to make sure our patients have that available to them, and you get matched based on your insurance. And they usually do take these mental health providers are usually taking insurance. So I'm hoping those barriers are being broken down too over the last few years and continue to do so. There are crisis hotlines that everyone should know about. 988, suicide and crisis line. And do you know of any others? Yeah, that's the main one.
They have them on a local level as well. So I think you can call the non-emergency line for police departments, and they can also refer you to whatever your local crisis center is as well.
Great. And they might even refer you to the local emergency room, which, to be completely honest, might not be fully equipped for it, but at least it's a safe space to avoid any true emergency where it's life-threatening.
Yeah, absolutely. And utilizing also, not all schools have them, but I think many schools now have counselors at the school that, can help and help find resources in the community locally, which can be a big help for parents.
So we mentioned social media before being a contributor to mental health for teenagers, probably even younger. Let's talk about that a little bit more.
Well, I think social media and screen time in general is a huge change that is important for parents to be aware of, actually how it can affect the brain hormones and how you are processing information. So it's not just, it would be nice to, but it is designed to increase dopamine in your brain, which affects your ability to process, increases with those quick hits of dopamine and reward that you're getting from social media. There's increased risks of addictive behavior, depression, cortisol increases, which lead to health risks later. And being able to have those conversations with your children and with yourself, right? This is where we all get to take it on a step back and say, how often am I looking at it? And is this interfering in a way? But there are actual chemical changes that happen in the body based on screen time and social media, and being able to recognize when it's difficult to put down, when it's taking away from in-person connection or other activities with your child, to be able to have that conversation. And I think have that conversation in ways where you're bringing in other resources. I like to use things like podcasts or other resources because despite the fact that I'm a pediatrician, I'm still a mom, which means my children may not think everything that I say is as valid as what someone else might be saying. It's important why we bring it up in the office.
Yeah. You mean your kids don't want to hear from you what they should and shouldn't do? No way.
Not all the time. Sometimes I like to have backup research to be like, look, I didn't make this up as a method of trying to control you. It's because it truly matters.
Yeah. Yep. And I think there are some positive social media presences that can help parents learn. I am a big fan of Good Inside, which is all about how to frame things to your kids, how to talk to your kids about stuff, how to deal with tough topics. But, the flip side is, as you mentioned earlier, social media creates this perfect world where everybody else looks like they're happy, they're living their best life every second of every day. And for someone who's struggling, I think that is a tough thing to face. It's hard to think about all the things that aren't shared on social media. You just think like, look at how happy everybody else is. What's wrong with me? And it's like a perpetual cycle. And then, I think also, we talked about this on another podcast, but what was that Netflix show we talked about, adolescence? Although that's like a really extreme, I think it did a good job of highlighting that there's a lot that happens that we don't know as parents. And if kids are on social media all day, the bullying, the things they're exposed to, we can't control all of that. And, that can be, I think, really detrimental in the long run too, if it's not really monitored. So.
Yeah. So I think monitoring is key. Limiting is key. Being involved, making it part of discussion for social media, and teaching kids what they can hopefully learn to self-monitor and control themselves, make them aware of like the dopamine hits they're getting and how that's impacting them. I mean, this is incredibly hard to do and stuff to deal with, especially when the peer pressure, if everyone else is doing it. That's why the okay to delay, wait until 8th for the smartphones and just pushing it off as long as possible is a really big initiative, which I truly believe in that we should all be doing. Like the longer we could wait to have that in their faces all the time, the better.
Yeah, and I think, and then also recognizing what are the positive benefits that they're getting from it, and helping teach them other ways to also receive that, right? So if there's connection, we all need connection in life, but can we foster other areas, other ways of getting connection that are in real life or in other manners, like acknowledging, not making it evil necessarily, but being able to say what needs are being fulfilled from this and how can we meet them in such a varied way instead of one distinct thing.
And talk about, like, put this together with the mental health. There's like just a true loneliness that comes out of that and inhibits them from being social and around their community. And we know that being around people and having support and loved ones, the more, the better. So that's why the screen just inhibits that. Yeah. Thank you so much, Dr. Tiffanie Noonan and Dr. Kristen Borchetta, for joining us on the Blueberry Pediatric Podcast. You can reach us by going to www.blueberrypediatrics.com. We are here for your physical and mental health needs. Please be checking all your resources locally should you need in this mental health awareness month. I'm sure there's always more to learn about what's being done in your own community. Thank you for tuning in for today's episode. Be sure to subscribe to the show for more episodes. And if you love the show, please be sure to leave us a 5-star review. Thank you all for tuning in to today's episode. Be sure to subscribe to the show for more episodes. And if you love the show, if you haven't already, please be sure to leave us a 5-star review.